In this lecture, we're going to provide a brief introduction to diabetes mellitus. And just to provide you with this overview, diabetes mellitus is defined, and this is a medical dictionary definition, as a disorder of carbohydrate metabolism. And it's characterized by hyperglycemia, which is a high level, abnormally high level of blood glucose, as we'll discuss in this unit, and glycosuria, which is an abnormally high level of glucose in the urine. And these symptoms, these signs and symptoms, result from either an inadequate production or inadequate utilization of insulin. Insulin being a hormone that is critical to the body's regulation of glucose. Over 2 million Canadians are affected with diabetes mellitus, and the vast majority of Canadians that have diabetes mellitus, as you can see here, approximately 90% of all those afflicted have what is referred to as type 2 diabetes mellitus. I'll define NIDDM shortly, as well as IDDM. Type 1 diabetes mellitus, as you can see here, only about 10% of those Canadians afflicted have type 1. A third type of diabetes mellitus that we'll discuss in this unit is what's called gestational diabetes. And this is diabetes mellitus that meets the same criteria as type 1 and type 2 in terms of the definition, but this occurs as a result of pregnancies. And although the statistics do vary somewhat, it's estimated that approximately 4% of all pregnancies develop gestational diabetes. And this prevalence is actually quite a bit higher in the range of 8 to 18% among First Nations women who, based upon the statistics, are predisposed to a greater extent at developing diabetes as a result of pregnancy. And that's we'll touch on and we'll address both type 1, type 2, and gestational in this unit. Just some more details on the term diabetes mellitus. The term diabetes is a Greek derivative that means passing through. And this is a reflection of a disease that's characterized by an excessive amount of urination. And so this is not specific to glucose, but this is one of the signs that people demonstrate that are afflicted with diabetes. Now, when we associate diabetes with the term mellitus, mellitus is a Latin term, a Latin-derived term, which means sweetened with honey. And that suggests that this is a condition that is characterized by the presence, an abnormal amount of sugar in the urine, which the technical term for that is glycosuria. One other type of diabetes that we will not address in Unit 4, but worth mentioning here, is diabetes insipidus. And diabetes insipidus is a term, or is a condition, that is characterized, coming back to our first definition here, as by excessive urination. But this excessive urination with diabetes insipidus is not driven by any alteration in glucose metabolism, but is actually a reflection of a hormonal issue. That specific hormone is ADH, or antidiuretic hormone. Another term that's commonly used for antidiuretic hormone is vasopressin. So these are two terms that are used interchangeably that refers to a hormone produced by the posterior pituitary gland that functions to ensure the body does not dehydrate, and that occurs at the level of the kidney. So to come back to our focus here in this unit, as we talk about the three main types of diabetes, this table provides a convenient summary of the three types that we'll address. So we'll talk about type 1 diabetes mellitus, and as a reminder, we see 1 out of 10 Canadians afflicted with diabetes mellitus have type 1, whereas approximately 9 out of 10 Canadians have type 2 among the two types here. And we'll address gestational diabetes a little bit later on in this unit as well. The first column in this table identifies what's called the stages of blood glucose management. And so if we start with the first row here, normal glucose regulation, this can happen in people afflicted with type 1, type 2, and gestational, provided that adequate treatment is provided. But the column on the left-hand side, as we move down the rows here, we see that this is a progression. So there is a continuum that exists from moving from normal glucose regulation into impaired glucose regulation, which is common for all three types, and then that can progress into a full development of diabetes mellitus. And the approach for treatment does vary based upon the severity, either with respect to the fact that no insulin is needed, to the need for providing insulin just for effective management, to the most extreme case where insulin is needed for survival. And we see that people afflicted with type 1 diabetes mellitus are characterized by essentially all three levels here. But essentially, people that are afflicted with type 1, it's very rare that they do not need insulin. So there is the need for providing insulin in people with type 1. People afflicted with type 2 or people afflicted with gestational diabetes, you'll see that the need for providing insulin for survival is extremely rare, and it's not checked in these boxes here. But so people afflicted with type 2 or gestational either do not require insulin or require some insulin to effectively manage their blood glucose levels. So we're going to end this first part of our Unit 4 lecture here with this general overview of diabetes mellitus.